provide top notch education and awareness about fatty liver diseases to healthcare professionals, patients, and the families. Today, we are honored to have Dr. Rajeev Shandil, a renowned gastroenterologist from New Delhi, as our guest speaker. With over 15 years of experience in the field, Sir is known to provide exceptional care to his patients for treating various gastrointestinal disorders. His commitment to patient centered care and spreading awareness about MASLD is truly commendable. We are grateful for his dedication to improving liver health and educating others about this important topic. Without further ado, I would like to invite Dr. Rajiv to share his valuable insights on the management of MASLD. Over to you, sir.
Just a second. I think I've messed up with my screen. Just- Yeah. So, good evening, everyone, and thanks for joining me in discussing about a very common, in fact, the most common disease probably right now that we have amongst all the people in the country as well as all over the world, which is the fatty liver disease. It has recently been recoined as a metabolic associated steatotic liver disease. Earlier it was known as NAFLD, non-alcoholic fatty liver disease, but people thought that probably the word alcohol and fat, they have negative connotations. So they changed non-alcoholic to metabolic associated so that you have problems in metabolism like diabetes and blood pressure and increase in your fats like lipids. So that probably was a better word. And steatotic means fat for all practical purposes, but it looks rather more dignified rather than fat. So MASLD is just fatty liver, and then when the fatty liver gives rise to some kind of damage to the liver, that is known as steatohepatitis. That means there is some amount of inflammation happening in the liver, and then it can lead to liver disease like cirrhosis of the liver in a subset of people, maybe 20% over the next 20 years. So, if we talk about liver, it is the largest organ of human body, weighing on an average uh, about 1.5 grams with 5% fat, which is acceptable. Location is in the upper right hand portion of our abdomen, that is the which is what we call the stomach, and intestines, on top of the stomach and intestines, just below the right chest. It is pinkish brown in color when they see it on surgery or when it is taken out. And it's soft in consistency and it has a lot of vascularity. It is highly vascular because a lot of vessels go inside. A lot of the when the food we digest, it directly goes to the liver first, gets absorbed, assimilated, digested after digestion, and then it goes the all the nutrients are fed to the various part of the body by pumping by the heart. Uh, it destroys old red blood cells, processes all the nutrients, regulates our blood composition, produces bile, which is important for digestion, detoxifies the impurities in our blood, which comes from intestine and everywhere else. It breaks down alcohol and other medication also. So, but too much of medication and alcohol can sometimes damage the liver. It controls 500 metabolic processes at one time. So you can imagine what how important it is. As far as the size goes, it is the second most largest organ in the body after the skin. Skin also is important, but as far as the number of processes that happen in a person, there's no other organ as as important as the liver. It also produces the proteins, and the cholesterol, which we all talk about most of the times, is also produced by the liver itself. The outside cholesterol does have a role, but every person has a set point to of some amount of cholesterol with which he maintains his life, and it can go up and down depending upon how you treat your body with the various food stuffs that you consume. So MASLD is a condition in which the fat makes up more than 5%, which is usually taken as normal of the weight, and it is not caused by alcohol use. So there is another term which is known as metabolic alcoholic liver disease in people who take significant amount of uh, alcohol, and they also have metabolic associated liver disease like diabetes and obesity. So that is a different subset. Here we are talking about purely liver, fatty liver, which is because of obesity, diabetes, and uh, high lipids in the blood. If it left untreated, it goes on to metabolic sort of steatohepatitis, that is the inflammation in the liver. And being overweight or obese, having type 2 diabetes, or having cholesterol, which is high, are associated with the risk of MASLD and also progression of MASLD. So 1 out of 4 people have MASLD regardless of the weight. This is probably an estimation which is lesser than what we see normally. They say that in adult males in Delhi, at least, or in northern India, more than 55% of patients have fatty liver. And if you talk to people, they say that everybody would be having grade 1 fatty liver. Not everybody has it, but probably more than half of them may be having it at one time. But as far as data goes, and all the population, male, female, rural, urban, probably 30% of the population has fatty liver. More than 6 diabetes and 9 severely obese people have out of 10 have fatty liver. Male gender has been regarded as a risk factor for progression to further deterioration of this disease to MASH and fibrosis and ultimately cirrhosis. So this is the progression. Healthy liver becomes fatty, and then fatty liver becomes fibrotic, where inflammation takes place and scar tissue starts forming. More liver cell injury occurs, but then there is scar tissue destroy liver cell, and then liver is unable to work properly. This is the cirrhosis. And then end stage liver disease happens where you accumulate fluid in your tummy. You have veins dilated in the esophagus. Sometimes bleeding can happen. You can have uh, coma because of the advanced liver disease, and you can have a lot of kidney disorders also can supervene, and that is known as end stage liver disease. This is what the fourth one. The fourth picture tells us about only the earlier part of cirrhosis that later on leads to end stage liver disease, that is advanced cirrhosis. So fat accumulation of the liver is known as steatosis, as we talked about. Steatosis will lead to inflammation, and that is known as metabolic associated steatohepatitis. Scarring of the liver on benign stage is also known as fibrosis. That is, if the scarring starts happening, that is inflammation, fat accumulation plus inflammation and scarring, that is known as fibrosis, which is known as MASH, metabolic associated steatohepatitis. Steato means fat, and hepatitis means inflammation of the liver because of fat accumulation, and that leads to scarring. So the causes are for everyone to imagine, which could be obesity, metabolic syndrome, which involves diabetes, high blood pressure, high cholesterol. Obesity also is one of the part. Genetic background also. So if your parents have been obese and have these abnormalities of metabolic syndrome, you're also prone to develop this. And food intake, which is more junk, which is processed food, ultra processed food, being exposed to certain medicine also predisposes you to development of fatty liver, and physical inactivity like a couch potato, putting on weight, and obviously not metabolizing things. They will make you obese as well as lead to fatty liver. Being overweight or obese causes fat to accumulate. Obesity increases the amount of fat to constitute 5% to 10%. This leads to MASH and scarring of the liver. There's threefold increased risk of death due to cirrhosis, increased risk of MASH in diabetes. So there is this association is much more than in normal people. To about fourfold increased risk of developing diabetes. People who have fatty liver, they have, so it's a two-way communication, two-way association. Both of them each increase each other's incidence almost by 3 to 4 fold. Symptoms could be nothing at all to begin with, but as it progresses, or if the size of the liver also increases because of excessive accumulation of fat in the liver, there can be some amount of abdominal pain, mostly discomfort rather than pain. There would be weight loss when it is advanced liver disease. Loss of appetite might be there. Enlarged blood vessels are part of the disease process. You may have nausea. You may have spleen would be enlarged. Jaundice would occur if there is advanced liver disease, that is cirrhosis, and then complications. And you have red palm, extreme fatigue and confusion and trouble concentrating, that is encephalopathy. That is when the liver is not able to metabolize most of the things, then all the toxins, they just bypass the liver through the heart, they go into the brain, and there is confusion and there is trouble concentrating, and a person may slip into coma, which is most of the time is reversible, but then it is an advanced liver disease which may ultimately need a transplant at times. It is a silent killer because the progression of disease is very gradual. A silent killer because most of the time you don't even come to know that you are developing this disease, and you might actually present with a complication and without knowing that you have already have this disease. So blood test, ultrasound or a fibroscan, liver biopsy, and X-ray or MRI or CT scan, not X-ray but CT and MRI will be able to tell you कि जो आपको ये चीज बीमारी है या नहीं. ALT एक टेस्ट है जिसको SGPT कहते हैं. ये काफी हद तक हमें बताता है कि लिवर डिजीज आपको है या नहीं. तो जिनका SGPT या ALT लेवल नॉर्मल है, उसमें भी ये बीमारी बढ़ सकती है. So up to 80% of these patients can have normal ALT. So that is the problem with this disease, that सिर्फ ब्लड टेस्ट में कई बार ये बीमारी पकड़ में नहीं आती है. साथ में अगर अल्ट्रासाउंड या फाइब्रोस्कैन किया जाए तो शायद पता ज्यादा लगता है. एंड देयर इज नो डेजिग्नेटेड ALT कट ऑफ फॉर प्रिडिक्शन ऑफ कि ये बीमारी आगे बढ़ रही है. कोई ऐसा ALT ये नहीं बताता आपको कि आप मान लीजिए अगर 30 को आप नॉर्मल मानते हैं, यदि आपका 28 भी है, तो जरूरी नहीं है कि आप, अगर लिवर डिजीज आपको नहीं है, आपको फैट नहीं है और ये आगे नहीं बढ़ेगी. इट कैन स्टिल advance into fibrosis and ultimately advanced liver disease and cirrhosis. There are various tests which have been validated. एक FIB-4 है, एक NAFS NAFLD फाइब्रोसिस स्कोर है. वो बात करते हैं कुछ 4-5 चीजों की, जिनका एक फार्मूला, कॉम्प्लेक्स मैथमेटिकल फार्मूला में डाल दिया जाता है, और उसके साथ ये निकाला जाता है कि इन जब आप एक टेस्ट की बात करते हैं तो शायद वो ना बताए, पर जब कॉम्बिनेशन ऑफ टेस्ट के साथ एक मैथमेटिकल फार्मूला के साथ आप एक स्कोर निकालते हैं, तो वो स्कोर बता सकता है कि आपको फैटी लिवर है और वो फैटी लिवर कितना एडवांस हो चुका है. सो दे दीज स्कोरिंग मेथड्स हैव बीन एस्टैब्लिश्ड टू डायग्नोज more better than only the SGOT, SGPT, which is just a enzyme secreted by the liver that may not be able to tell you about the stage of the disease. और ये जो चीज़ें हैं ये हमको ऑनलाइन मिल जाती हैं वेरियस साइट्स पे, एंड वी कैन कैलकुलेट आवर स्कोर्स बाय ऑल द टेस्ट दैट वी टॉक अबाउट, दैट इज एज, AST, ALT, प्लेटलेट काउंट, हमारा BMI जो हमारा kg पर मीटर स्क्वायर में निकाला जाता है, कितना, और हमारी फास्टिंग शुगर कितनी है, और हमारा अंदर प्रोटीन जो अच्छा वाला प्रोटीन एल्ब्यूमिन होता है वो कितना है. उसके हिसाब से ये स्कोर निकाल के हमें पता लग सकता है कि हमारी जो डिजीज अगर है तो कितनी एडवांस कर रही है. अल्ट्रासाउंड जो है इजीली अवेलेबल है, हर गली नुक्कड़ कॉर्नर पे मिलता है. इकोनॉमिकल है, बहुत ज़्यादा महंगा नहीं है. रीज़न फॉर मोस्ट एक्सीडेंटल डायग्नोसिस ऑफ MASLD. अल्ट्रासाउंड आपने किसी और चीज़ दर्द के लिए या किसी स्टोन के लिए करवाया, जो आपको दर्द हुई तो पता लगा कि लिवर भी फैटी है. पर इट डिटेक्ट्स MASLD इफ फैट इज मोर देन 25%. तो ये प्रॉब्लम है इसमें, जो 5 से 25% की फैट है वो शायद ये मिस कर देता है, और फाइब्रोसिस और फैट के बीच में ये डिफरेंशिएट नहीं कर पाता. इसको सिर्फ फैट दिखेगी, ये अल्टीमेटली सिरोसिस दिखेगा. जो इन दोनों के बीच की स्टेज है, जैसे फैटी और सिरोसिस के बीच में जहाँ फाइब्रोसिस हो रहा है, वो आपको अल्ट्रासाउंड से नहीं दिख सकता. उसके लिए आपको फाइब्रोस्कैन की जरूरत पड़ जाती है, जहाँ पे जिसको बोलते हैं ट्रांजिट इलास्टोग्राफी. ये भी एक तरह का अल्ट्रासाउंड है, पर ये स्पेशलाइज्ड अल्ट्रासाउंड है, और इसमें दो चीजें दिखती हैं, एक तो अमाउंट ऑफ फैट और एक अमाउंट ऑफ फाइब्रोसिस. सो इसकी वैल्यू जो है 240 तक नॉर्मल ली जाती है, कैप इसको बोलते हैं। और जो स्टिफनेस है लिवर की वो 6.5 तक नॉर्मल मानी जाती है। So diagnosis of MASLD with fat in more than 10% differentiate between fibrosis and fat content and easy to operate, but it's a specialized test which is less easily available than a simple ultrasound, but it can misinterpret in obese patients for technical reasons. So अगर आपकी ये वैल्यू यहाँ पे 240 से नीचे है और यहाँ 6.5 से नीचे है, तो आपका लिवर अच्छी तरह से काम कर रहा है, उसमें कोई प्रॉब्लम नहीं है। इवन इफ योर SGOT SGPT आर हाई, देन दे कुड बी अदर रीजन फॉर दैट, बट फैटी लिवर इज नॉट द कॉज फॉर योर SGOT or SGPT rising. And this value that has been written, 198 and 5.2, is a perfectly normal liver. No amount of fat in the liver and no amount of damage because of fat or any other reason also for that matter. This works on the principle of transient elastography, जिसका मतलब जैसे हमने कहा LSM इज लिवर स्टिफनेस मेजरमेंट, जो कि 6.5 से नीचे होनी चाहिए नॉर्मल में। 6.5 से लगभग 14 तक मतलब लिवर में फाइब्रोसिस हो रहा है, और 15 के बाद या 14 के बाद मतलब आपको लिवर में सिरोसिस होना शुरू हो गया है। कैप का मतलब कि कितना फैट है। कंट्रोल्ड अटेन्यूएशन पैरामीटर इंडिकेट्स द डिग्री ऑफ स्टेटोसिस। स्टेटोसिस मींस फैट। सो कितना जितना आपकी वैल्यू हाई होगी, इसका मतलब उतना आपके लिवर के अंदर फैट भरा हुआ है। एक और एडवांस टेस्ट है MRI PDFF, जिसको कि बहुत कम जगहों पे अवेलेबल होता है। इसके लिए एक अलग ही सॉफ्टवेयर की जरूरत होती है, तो हर जगह ये अवेलेबल भी नहीं होता। और खासकर इसका इस्तेमाल तब किया जाता है जबकि हमें या तो बहुत ही कोई ज्यादा चिंतित हो अपने फैट की फ्रैक्शन निकालने के लिए, और या फिर ट्रांसप्लांट से पहले, यानी कि किसी ने लिवर डोनेट करना है किसी अपने रिलेटिव के लिए या किसी और के लिए, तो जब हम उसको देखते हैं कि थोड़ा फैटी है, एग्जैक्ट अमाउंट ऑफ फैट पता करनी है, क्योंकि अगर हम उसका लिवर लेकर किसी और दूसरे में लगा देंगे तो दोनों का नुकसान होगा। इसको लिवर कम पड़ जाएगा और उसका भी पूरा नहीं होगा, तो दोनों पेशेंट्स के लिए खराब होगा। सो इन सर्टन पीपल MRI PDFF इज रिक्वायर्ड, सो दैट इज व्हाई इट इज नोन एज गोल्ड स्टैंडर्ड टू डिटेक्ट द फैट कंटेंट। इट कैन मेजर फैट इवन which is more than 1% than normal, and widely used technique for liver donor patients, as we talked. So it's costly and not widely available. Then ultimately liver biopsy, but it's a gold standard. It again is a gold standard. Only method to diagnose fibrosis with certainty, and it can also rule out other diseases apart from fatty liver. Uh, it is painful, it is individual dependent, and chances of misdiagnosis in the early stages are also known in fatty liver disease. And also the fact that it has got uh, bias, because you may hit an area where if the cells don't have too much of fat, so you may underdiagnose it. The fatty liver को आप underdiagnose कर सकते हैं. So each modality has its plus points and its flip side, that is the negative points. So when we talk about the progression, it takes years, बहुत साल लगते हैं फैटी लिवर को आगे बढ़ने में। अगर शराब की वजह से तो बहुत जल्दी बढ़ता है, डिपेंडिंग अपॉन द अमाउंट ऑफ अल्कोहल दैट यू आर टेकिंग। बट इफ यू इट इज ओनली बिकॉज ऑफ मेटाबॉलिक फैक्टर्स, then it takes years. Early intervention will always be beneficial. So when you talk about MASLD, 75% of people will have isolated fatty liver and very minimal fibrosis and no risk increases for death compared with the general population. So you want to remain in the first line here actually. So even if you have small amount of fatty liver, if you maintain that much amount with your diet, lifestyle, exercise, and good habits, you may have small amount of fatty liver, but you will lead a normal life, and you will go whenever it is your time to go without the liver or any other factor being the cause for your death. So that is where you need to say as far as your liver health is concerned. Then you have a fatty liver with mild inflammation. uh, इसमें हो भी सकता है कि थोड़ी सी वेरिएबिलिटी हो और थोड़ी बहुत प्रोग्रेशन हो सकती है मैश की तरफ, जो कि 20 से 25% लोगों में होती है। उनमें से जिनमें मैश हो गया मतलब फाइब्रोसिस या स्कारिंग शुरू हो गई थोड़ी बहुत लिवर में, कुछ लोगों में 15 साल में सिरोसिस हो जाएगा, और उनमें से अगले 6.5 साल के अंदर कुछ लोगों में लिवर कैंसर हो सकता है, और लगभग अप टू 50% लोगों में अगले 7 8 10 साल में डिकम्पोजिशन हो जाएगी। मतलब सिरोसिस के साइड इफेक्ट्स जो हमने कहा, जॉन्डिस होना, पेट में पानी भरना, किडनी पे असर पड़ना, बेहोशी होना, ये सब, और ब्लीडिंग होना, ये सब चीजें हो सकती हैं। सो जब मैश होता है तो देर इज इंक्रीज रिस्क ऑफ अदर ऑर्गन्स ऑल्सो गेटिंग इन्वॉल्व, बिकॉज जब फाइब्रोसिस होता है तो देन जब इतनी फैट आपकी लिवर की जो मेटाबॉलिकली एक्टिव है, मतलब वो आपके ब्लड वेसल्स के अंदर घूम रही है, तो जब उसने लिवर को डैमेज कर दिया तो इसका मतलब वो ब्लड वेसल्स के थ्रू और ऑर्गन्स को भी डैमेज कर रही है। तो इसका मतलब आपको हार्ट में प्रॉब्लम हो सकती है, आपको कैंसर भी हो सकते हैं। एंड नैश विद फाइब्रोसिस पोटेंट्स वर्स प्रोग्नोसिस, मतलब फाइब्रोसिस प्रोग्रेशन, अगर फाइब्रोसिस होता गया तो अगर साथ में डायबिटीज है या इंसुलिन रेजिस्टेंस, मतलब डायबिटीज से एक स्टेप पीछे, या आपका वेट बढ़ता जा रहा है, AST LT बढ़ते जा रहे हैं, सो इसका मतलब यह रहता है कि ये डिजीज आपकी प्रोग्रेस कर रही है। तो इसको रोकने का तरीका तो यही है कि हेल्दी लाइफस्टाइल, and sometimes drugs are also required, and they have about 25% of benefit, but mostly it's the lifestyle most of the times. So you have to stay in the first line where it remains a very minimal isolated fatty liver, and you maintain it for long period of time. So act before it is too late. Metabolic dysfunction associated with steatohepatitis is a more serious form of MSLD in which you may have scarring. MASH may lead to cirrhosis or liver cancer, and severe MASH is not reversible. Progression of MASH also increases the risk of heart diseases. Treatment, lifestyle modification is the real thing. So इसमें भी जो तीन चीजें बताई गई हैं, डाइट, एक्सरसाइज, लाइफस्टाइल मॉडिफिकेशन, सो टेक roughage, green leafy vegetables, less of carbohydrates, more of proteins. They say that if आपकी थाली जिसमें जो होती है, you should eat 20% less than your the amount of hunger that you have every time, and half of your thali should be proteins, 1/4 should be carbohydrates, अनाज, और 1/4 में fruits, vegetables हो सकते हैं. Exercise should be regular. Basic minimum is about 30 to 40 minutes of brisk walking. So that means 3 to 4 kilometers in 30 to 40 minutes. And resistance training, if it can be done, is also a good form exercise. And try to avoid all these bad things. And there are new medications which are coming up. They'll keep coming as the years advance, and they may offer better advantages. But at the moment, probably as these four uh, pictures are showing, the the disease will respond to drugs in by 25%. Most of the things, 70 to 75%, it is your lifestyle which will determine how your disease behaves. So speak to your doctors about the treatment options, and they will also decide about what is best for you. uh, Combination of a calorie deficit diet where less calories are taken in and than what is required for your activity, which leads to weight loss and also fat which gets out of the liver, and moderate intensity exercise provide best likelihood of sustained weight loss, and that should be continued. Because if you reduce your weight, the problem with the weight loss is that you reduce your weight but then you regain it again because of faulty habits. Weight loss of now used to say 5%, but most of the people would probably go for 10% now. It improves majority of histopathological features of not only MSLD, but your some fibrosis also. So, weight loss effect on MASLD, this keeps on changing. More than 3%, it will reduce steatosis by the percentage that is given there here. More than 5%, the inflammation will come down, NASH resolution by 7%, and fibrosis will also start coming down by 10%. But ultimately, I think you should wait for, you should uh, aim for 10% weight loss, or best is to go for your normal body weight, which in most people would be your height in centimeters minus 100. So say suppose your height is about 160 centimeters, which comes out to be at 5'4" or 5'5". So your weight should be about 59-60 for males, and for females, it should be about 4 5 kgs lesser than that. So maybe about 55 to 56. That is your ideal body weight. Your BMI would also be good in that, and that is the weight which will be good for all the organs of your body, and your mobility will also be good. You will be feeling good, and your organs will also bless you for having maintained them well. तो डाइट जिसे हमने बात की कि weekly moderate portions of poultry, eggs, cheese and yogurt because they have proteins. Every day we should have meal जिसमें कि vegetables हों, fruits हों, whole wheats, grains, olive oil, whole wheat also. The amount should be less, but it should be whole wheat. Grains, olive oil is good. Beans, nuts, legumes and seeds because they have proteins, and herbs and spices in moderation. Less often you should have red meat and sweets because that is only for the tongue. They don't have too much of nutritional value as far as protein content is concerned or your liver health is concerned. And fish and seafood are good because fish and chicken are the two non-veg food items which, if taken boiled or grilled, they are good for your protein intake. Aerobic exercise and resistance exercise both are important. एरोबिक एक्सरसाइज रिड्यूसेस लिवर फैट, मेंटेन्स हेल्दी वेट एंड और कार्डियोवास्कुलर कंडीशनिंग भी अच्छी करती है जिससे कि हार्ट रेट बढ़ता है। रेजिस्टेंट एक्सरसाइज में हार्ट रेट नहीं बढ़ता पर इन्फ्लेमेशन रिड्यूस होती है लिवर की, और ग्लूकोज एब्जॉर्प्शन, ग्लूकोज की जो इंसुलिन सेंसिटिविटी हम बोलते हैं, ग्लूकोज अच्छी तरह से मेटाबोलाइज होता है जो भी आप मीठा थोड़ा बहुत खा लेते हैं या अनाज में भी जो ग्लूकोज बनता है, और मेटाबॉलिक पैरामीटर्स को इम्प्रूव करता है विद लेस एनर्जी एक्सपेंडिचर. सो बोथ ऑफ देम इम्प्रूव द फैटी लिवर एंड मेक इट टू अ नॉर्मल लिवर. आगे चलते हुए अब इसकी बात करते हैं, तो एक्सरसाइज रूटीन तो बनाना जरूरी है ही है, और उसके साथ चलना बहुत जरूरी है. मेंटेन तो आप कर शुरू तो आप कर देंगे, 2-3 हफ्ते तक, महीनों तक कर सकते हैं, पर दिस इज अ लाइफ लॉन्ग इशू एंड लाइफ लॉन्ग आपको ये करना चाहिए. और एनफ स्लीप, इट कैन नॉट बी एम्फसाइज मोर, बिकॉज अगर आपकी नींद कम है तो आपके बहुत सारे ऑर्गन सिस्टम्स खराब होते हैं, और लिवर और फैट भी उसमें से एक है. लेस ऑफ स्लीप एक्चुअली लीड्स टू वेट गेन एंड दैट इज नॉट गुड फॉर योर लिवर ऑल्सो. सो 7 hours of sleep is taken as ideal for everyone, and mostly it should be an uninterrupted, it should be uninterrupted sleep. मतलब एक बार में वो सो लें 7 घंटे. आप ये मत बोलें कि मैं 3 घंटे और 2 घंटे और 2-2 घंटे करके सोऊंगा. इंटरप्टेड स्लीप डजंट हेल्प एनीबडी. मैं विटामिन एंड मिनरल्स जो खाने में भी हमें मिल जाते हैं, कई बार बाहर से लेने पड़ते हैं, पर आमतौर पे खाने में पर्याप्त मात्रा में होते हैं अगर हम एक पौष्टिक भोजन और एक बैलेंस डाइट ले रहे हैं. मेडिकल चेकअप्स cannot be overemphasized. These days you are having heart troubles, you are having undiagnosed problems. Earlier also you must be having it, but होता यही है कि अगर हम साल में एक बार अपना मेडिकल चेकअप कराएं और इसमें सिर्फ एसजीओटी, एसजीपीटी या अल्ट्रासाउंड कराएं तो फैटी लिवर के बारे में आराम से पता लग सकता है. स्मॉल फ्रीक्वेंट मील्स के बारे में हमने बात की, एंड शुगर इनटेक या कार्बोहाइड्रेट्स लेना कम लेना बहुत जरूरी है. जो हमारी लिवर एसोसिएशन है इंडिया की, वो ये रिकमेंड करती है 3 दवाइयों के बारे में: पियोग्लिटाजोन, सारोग्लिटाजार और विटामिन ई. और ये तीनों दवाइयाँ डायबिटिक या नॉन डायबिटिक में दी जा सकती हैं, और विटामिन ई तो पेडियाट्रिक पेशेंट्स में भी दी जा सकती हैं. और इनका जो समय का अभी तक बताया गया है वो 2 साल से 1 साल के बीच में होता है. पर ये एक ऐसी बीमारी है जो शायद अगर आप अपना ध्यान ना रखें तो ये बीमारी तो चलती रहेगी. तो इसका जो, अगर आपने 1 साल के लिए सारों सपोज ले भी ली, और आप फिर वहीं से, अगर आप छोड़ने के बाद फिर वहीं पहुंच जाते हैं, तो ये दोबारा भी शुरू की जा सकती है, और हो सकता है कि इसकी जरूरत आपको बहुत लंबे समय तक भी पड़े. So, tips to prevent: limit intake of saturated fats and trans fats, eat a balanced diet, consumption of refined carbohydrates has to be minimized or eliminated, और हेल्दी वेट पर करना जरूरी है. स्मोकिंग इज अ बिग नो नो फॉर एवरीवन, फॉर एवरीथिंग, नॉट ओनली लिवर. एक्सरसाइज, alcohol limit if you cannot avoid. Ideal is to avoid, but limit, and take medications as prescribed. Unnecessary over-the-counter medicines for small things should be avoided. And let's not be silent anymore about this. This is a silent disease, and your liver could still be at risk even though you don't drink alcohol, because fatty liver disease is a metabolic disease. If you're a couch potato, you don't exercise, you don't eat healthy, you don't have a healthy weight, तो ये आपका लिवर जो है ये पक्का आपको कभी ना कभी प्रॉब्लम दे सकता है. So Ayushman Liver, and I'll be happy to take any questions.
Thank you, sir, for this wonderful talk. This has enlightened us, and now, with your permission, I would like to take few of the queries which I have received.
Yeah.
So, one common query I received was like, is MASLD any age specific, or it could happen to people of any age?
No, no, it can happen to even pediatric age group people. You can have 3 or 4 year old guy who has a fatty liver. So the healthy lifestyle has to start from the moment you are born, because the उल्टी गिनती शुरू हो जाती है पैदा होते ही. जैसे ही आप पैदा हुए, your उल्टी गिनती has started for your, it is counting you the years, number of years you are going to live on this mother earth. So this disease will start from your childhood, and it will keep on. If you in the childhood, obesity is a very big risk factor for early fatty liver and cirrhosis.
Okay. So, one question we received is, how common is MASLD in Indian perspective?
I think I covered this in my talk. They say that 30% of the population has it. That is all comers, whether you are a villager or urban dweller, मेल फीमेल कोई भी हो. पर कुछ स्टडीज ऐसी हैं जिनमें जब देखा गया है, जो कि पॉपुलेशन में की गई हैं, ना कि उन लोगों में जो कि हॉस्पिटल में आए हैं. अब अगर आप बोलें कि जो 5 स्टार हॉस्पिटल या कॉर्पोरेट हॉस्पिटल में लोग आते हैं, उनमें तो शायद मैं बोलूँगा 70% से ऊपर लोगों को फैटी लिवर पाए जाते हैं. पर जो पॉपुलेशन स्टडीज करी गई हैं दिल्ली में, जो मैं बता रहा हूँ मैं, उसमें 55% मेल्स को फैटी लिवर पाया गया है. फीमेल्स में अप टू 35 to 40%. बट अगर आप पूरी पॉपुलेशन को देखते हैं तो 30%, मतलब 30% लोगों में है. मुझे नहीं पता कोई ऐसी बीमारी है दूसरी कोई और जो कि सारी पॉपुलेशन में इतनी ज्यादा मात्रा में पाई जाती है. सो वेयर योर मिनिमम परसेंटेज इज 30% एंड यू कैन गो अप टू 70%. टेल मी अबाउट एनी अदर डिजीज विच इज present in the whole of the population in these many percentages.
Right, sir. So then one question is, you shared information on dietary modifications. So that holds true for alcoholic fatty liver disease as well as MASLD, or it is specific to MASLD only?
You see, it is not only for muscle, it is basically healthy diet. It is also good. The healthy diet is only one, and unhealthy diets are different. यू कैन हैव अ फेटिश फॉर एनी अदर थिंग. कोई चीज आपको बहुत पसंद है तो वो आपको खराब कर सकती है. कोई चॉकलेट ज्यादा खाता है, कोई पेस्ट्री ज्यादा खाता है, कोई कुछ, कोई अनाज ज्यादा खाता है, कोई चावल ज्यादा खाता है. सो ऑल अनहेल्दी डाइट्स आर मेनी, बट हेल्दी डाइट इज ओनली वन. So when we are talking about diet about fatty liver disease, it is a diet for every disease. It will prevent your fat, it will prevent your fatty liver, it will prevent your cancers, it will prevent all other diseases. Actually, it is a healthy diet for general health, and it is good for the liver also, and ultimately it is good for your general health. So alcoholics also need the same amount of same type of food stuff. Yes, apart from leaving alcohol.
Right, sir. And one last question we have. Supposedly, if we have this fatty liver, so is it reversible or we have to live with it permanently?
तो दैट्स अ वेरी इंपॉर्टेंट क्वेश्चन. बट बात वही मैंने वही की जो जो टेबल में हमने बात की थी, जो सबसे ऊपर वाली लाइन है. अगर रिवर्सल पॉसिबल है, पॉसिबल रिवर्सल तभी है कि अगर आप बहुत ज्यादा फैटी हैं, और अगर आप अपने नॉर्मल वेट को हिट कर सकते हैं, या सेकेंडली इफ यू कैन रिड्यूस योर वेट बाय एटलीस्ट 10%. सो इट इज रिवर्सिबल टू अ लॉट ऑफ एक्सटेंट. बट दैट इज नॉट इम्पॉर्टेंट. वो उतना इंपॉर्टेंट नहीं है जितना इंपॉर्टेंट ये है कि अगर आप ग्रेड 1 फैटी लिवर में, थोड़े से लिवर फैटी लिवर में हैं, और आपके एंजाइम बहुत ज्यादा खराब नहीं है, अगर उसको आप वहीं पे भी रखें, उसके बाद अपनी दिनचर्या को ठीक करें, अपने वेट को ठीक रखें, खाना ठीक से खाएं, और ये सब करें, तो आप उसको 30 35 40 साल तक मेंटेन कर सकते हैं. एंड दैट इज, आई मीन, इफ यू आर फाउंड एट 35 40 to be having fatty liver, and if you can maintain it for 35 40 years, that is done. More than 80 years you will live. So the point is not that it is reversible or not. The point is that you should not be allowing it to progress.
Right, sir. Thank you very much. I think these were the questions we had received. And on behalf of Nash 24 by 7, I extend my sincere thanks to Dr. Rajiv for his enlightening and engaging talk on MASLD. Sir's insights have highlighted the critical need for increasing awareness about fatty liver disease and related conditions. I want to express my appreciation to the audience also for their valuable contributions in terms of queries. Your feedback and suggestions are always essential as we strive to enhance our future Facebook programs and educational initiatives. Please stay connected with Nash 24 by 7 on Facebook for updates and information on upcoming events. And remember, your health and the health of your loved ones is of paramount importance. Take care and stay well. Thank you once again, and thank you, sir, once again for your valuable talk.
Yeah, thanks for having me, and good night, everyone.